I didn't really think much of it because at the time I was 34 years old, no family history of breast cancer. I just thought it was maybe a cyst or something.
She's such a sweet girl, so young. She struck me though as a very strong, really independent person.
The doctor that was doing the ultrasound had said, "I'm pretty sure it's breast cancer, but we'll do a biopsy just to make sure," which I was shocked at because you don't think that's what you're going to hear. August 19th, I had my biopsy, and I had prepared myself for the worst, and August 20th, I found out the worst.
Amanda was diagnosed with an advanced breast cancer. This is what we call a stage 3, meaning that it was a larger cancer and it had infected the nearby lymph nodes.
My husband was there with me, and I heard, "Well, I hate to tell you, but you have breast cancer." And I thought to myself, I don't understand how at the age of 34 I could have breast cancer. This doesn't happen to me, it happens to other people. I live up in Manitowoc, so it was kind of a bit of a drive, a little over like an hour and 15 minutes. But honestly, you think of your health and where the best place is for you to be, and the ride didn't matter.
In order for her to be able to possible for her to receive treatment here, I felt like I was in a good position to coordinate all of that, so that when she was driving down an hour and a half, we made the most of those appointments. Set her up for our multidisciplinary clinic, where she had a chance to meet with her surgeons, her medical oncologist, the radiation oncologist, our genetic counselor was involved, our research nurse was involved.
I think we have one of the best provider teams, at least in the state, if not in the country. We have a huge commitment to cancer care at Columbia St. Mary's. Our multidisciplinary conferences are extremely well attended. We have radiology, pathology, our study coordinators, our nurse navigators who are invaluable, our genetic counselors. So we have a huge team of people who have a very strong commitment to this. And that's something really remarkable about Columbia St. Mary's, that we have that opportunity every week or twice a week to be on the same page, to talk about patients, to redirect, to have consultations with each other.
I love that we bring people in, they're scared in the morning and they leave at the end of this appointment with a smile on their face. But they have a chance to kind of bring whoever they want. They can bring their whole family in. They come in for one appointment, they stay in one room, and we just bring in the team one at a time.
I met with Dr. Nand and Dr. Lal and Peggy, and I knew from the very beginning that I was in the right place, that I was going to be okay. I had a rough road ahead of me, but it was going to be fine. From day one, they just had everything here. They had everything so organized. It just made sense. So I made the decision that I would have my treatments down here.
I think being in a community practice, we realize that we're treating our neighbors, our friends, our community. And so we very much approach our program in that way, that it's a family and we're treating other members of our family.
They are like an extended family. Honestly, you come in and joke around with them. You come in and you're at your lowest, your worst, and they are there for everything for you. To get you this, to get you that, to make you feel comfortable, to make you laugh.
Yeah, that makes sense. Very well.
Early detection is so critical in the fight against breast cancer. We try to conceptualize the fight against breast cancer as one of prevention, and then, if necessary, one of treatment. We like to not have anybody get to the treatment aspect of it. Finding breast cancers in their earliest inception results in the best outcomes.
We're very pleased to have 3D mammography or tomosynthesis. It goes by either name. And the technology is a way of obtaining a mammogram and giving us more information and potentially increasing our detection rate of invasive cancer and decreasing our false positives. Columbia St. Mary's has made the commitment that all of our patients, if they are able to go through the examination, will get 3D mammography or tomosynthesis. If we find a breast cancer and we detect it, we're usually going to detect it earlier with 3D, and then it is treated with less aggressive therapy. The goal is to cure a woman of cancer with the least amount of invasive treatment.
One thing that I think is very special about Columbia St. Mary's is that we treat people very much like people and not like diagnoses. I think we have a very strong commitment to the mind, the body, the spirit, and we bring that to every patient encounter and also to what we offer patients.
I'm sitting right here, right now, because of them. If it wasn't for Dr. Nand and Peggy and the nurses, I mean, I wouldn't be here today. Excuse me. These aren't, tears of sadness or tears of joy, because I am here today talking to you and I'm sharing my story and hopefully educating other people on, why it's so great to work with Columbia St. Mary's, why donating to them means so much. I'm here today because of that, because of all the help that they provide. Their, love and care, and it's just amazing to me. It doesn't even seem like a hospital experience, honestly. It just seemed like I was going to hang out with friends and family and get a little chemo on the side. So, but I owe my life to them. I really do.